My name is Cecilia Brown, Esquire. Up Close and Cultural is where Black and Brown professionals give you the keys and insight to leverage your power against systemic discrimination. Cultivating our culture through knowledge that has been historically weaponized against us. My hope is to increase your quality of life. If knowledge is power, then power to the people. Thank you for watching Up Close and Cultural. I'm your host, Cece Brown. Dr. Meena Singh is a board-certified dermatologist and dermatological surgeon. She attended Harvard Medical School, trained at the Mayo Clinic, and completed a fellowship with the International Society for Hair Restoration Surgery. Dr. Singh is the medical director of the KMC Hair Center. Her passion is treating and restoring disfiguring forms of hair loss seen exclusively in patients of African descent. Meena, thank you so much for being here. I just want to point out that in both the professions of being a doctor and being a lawyer, less than 3% are Black women. That's wild.
Yeah, it is.
There's so much talent among us. Why do you think that less than 3% of doctors are Black women?
So first of all, no one likes that situation. We're not in a field, especially as Black doctors, that we want to be the only person in the room. We don't like being like high achieving and then nobody else is around us that looks like us. That is not something we want. We want more of us. There could never be enough great Black physicians in this country. So we always try to work on the pipeline because that's the situation, especially with dermatology in particular. It's the most difficult and competitive specialty to get into within medicine in itself. So, not only do you have to have gotten into medical school, you have to come from a good medical school and then be one of the top students at that medical school even to get considered, really to make it easier to get considered, I should say. So, we really try to focus on the pipeline. So we do a lot of mentorship programs where we're trying to get students as early as possible, usually within middle school, and get them encouraged to pursue medicine. And then while they're in medical school or while they're pre-med, have them have the help to get the resources to get into the competitive specialties, because that's really what it takes. When I was in undergrad, we had 20 to 25 pre-med students like myself that were Black. And by the time we graduated, I was the only one that was Black in a pre-med who graduated and went straight to medical school. So, and I was at a major university. And so, out of our little pipeline, it was just one of us. And that was at the university level, so it really is something where we have to be seen, and representation really matters. And I always say, if they can't see us, they can't be us, right? If you don't know that we exist, then why would you want to pursue something like that?
Absolutely. It really struck me when you said you guys are reaching into middle school.
Absolutely.
Because, one thing that we know is that in professional careers like being a doctor or being a lawyer, you see this generational succession.
Absolutely.
And I think we all know at times we weren't allowed to be doctors.
That's right.
We weren't allowed to be lawyers. And so we don't come from that many, generations back. I don't know. I know that your mother is a doctor.
Yes.
So you've got a couple generations, but I'm a first generation lawyer.
Right.
Reaching into middle school so that people know that they can do it without that, right? I think that's really awesome.
Yeah, I think you actually nailed one particular point. We weren't allowed to be physicians at many medical schools. So my mom is a physician, like you mentioned, but she was the first Black female to graduate from her medical school.
Wow.
And this was the 1970s, right? So prior to that, they had no other Black students, right? Especially female. So we're fighting against our history. And again, without my mom being a physician, I would have never gone into medicine whatsoever. She is like my primary role model when it comes to that. And actually in the community, she's one of the people that kind of everyone knew as like a Black doctor. And that made a lot of them at least consider that as a profession, as opposed to the representation that we usually see, which is us in entertainment and us in sports, which is fine because we do excel in that. Like, we are the best in a lot of things, but if you are seeing only that as opposed to us, lawyers and doctors, then it kind of changes your mindset about what's possible.
That's awesome. And let me just say this, I'm paying so much honor to your mother because we need you. So the fact that she set that example, awesome, because what we're really experiencing in this time is Black and Brown experiences not being taken serious in the medical field.
Absolutely.
Especially what we're here to talk about today, just regarding skin conditions, hair loss.
Right.
I was reading an article the other day, and this woman said when it came to COVID, the skin symptoms or skin conditions weren't popping up shown in Black and brown skin.
Absolutely.
What's going on?
So this is why it's very important to have more Black dermatologists in particular, because skin is different than other organ systems. So say you broke your bone, right? We would fix it no matter what you look like. It's the same workup, it's the same diagnosis, it's the same management. With skin, it's completely different depending on what you look like, depending what your ethnicity is. So having physicians and dermatologists that care about those things really matter, because it changes how you're treated, how you're managed, and your overall outcomes. So the way that skin disorders and hair disorders present in brown and Black skin, it manifests differently. We sometimes are more likely to have certain entities or certain disorders, and the way you treat us or when we manage these conditions is completely different, right? So the same treatments I can do on like non-brown and Black skin, we call them Fitzpatrick 1 through 3, which basically means that you sunburn more easily. I could just remove like all the skin. I could do this deep peel. I can do all these like laser procedures. We cannot do that in skin of color. We would cosmetically disfigure them, right? So you have to know how things present, you have to know how to manage them, and you have to care about those things. So in my residency, we did not have a lot of skin of color training. And I know you're kind of alluding to this, in our textbooks, we did not have a lot of pictures of skin of color, right? So we're all working to try to change that, but I had to do a special rotation at a skin of color program in order to get that training. And then I had to do a special fellowship in hair loss in order to get a better understanding of hair loss in us, really, because we actually present with different forms of hair loss even.
Meena, I love following your Instagram page because
Thank you.
Obsessed with extractions, but I'm also obsessed with Black hair. What do you see is the difference in African hair as compared to other demographics?
Yes, thank you so much for asking that, because it's actually a big difference, and this is my expertise, so I'm very glad you asked me about that. So interestingly, with every other demographic that is not of African descent, patterned hair loss, like the normal balding that you see men and women have, we call that patterned hair loss or androgenetic alopecia. That's the most common form of hair loss, right? Mm-hmm. And that's not something you can do anything about as far as like predisposition. It's your genetics, environmental factors, systemic factors. But there's also another condition called telogen effluvium, where your hair just sheds more than normal, and that's temporary. So those things are the most common forms of hair loss for every other demographic. For people of African descent, though, our forms of hair loss are different, and they're more cosmetically disfiguring. So our most common kinds are traction alopecia, actually. And traction alopecia is avoidable, right? We do it to ourselves, but sometimes it's not. Sometimes, our parents do it to us, right? And so the way that we wear our hair, and we've all done it, right? We want all the cute, we've done every hairstyle. Yes, exactly. And so all of us had our parents with 50 different braids and ponytails before we go to school every day.
Beads,
with the beads,
bobbles.
All these things. Yes, and so some of us feel that our traction alopecia is just genetic, right? Like, well, other people in my family have it. It's actually not. It's what we do to ourselves. It's caused by tension producing hairstyles that is repeated over time chronically. Wow. It starts off with shortening of the hairs, and then over time the hair falls out, and then after you continue to produce those hairstyles, they just don't grow back at all. So that is very cosmetically disfiguring because it's your frontal hairline, right? That's how you present yourself to the world. And actually almost 1 to 3 Black women have this problem or have some form.
You saying that is so wild, because my mother and my sister, I know that they have traction alopecia, and it's wild because I always just thought it was in our genetics. Like my mom has it, my sister has it, and I'm always just like, baby Jesus.
Trying to save
Don't snatch my edges,
yes,
okay? But now it sounds like if I just don't wear my scarf as tight at night, or if I don't pull back my hair.
Yes, please. Actually, so just while we're on the subject of traction alopecia, there are many things, especially scarves, that we don't realize are actually causing the tension or the traction. So we usually associate them with braids, weaves, what's it called?
That I love.
What is the one with the adhesive? Quick weaves.
Oh, the
quick weaves are
what about lace fronts? What do you think about lace fronts?
Anything that has glue or adhesive, that's the most traumatic. Okay. And then if you're combining your tension and producing hairstyles with a relaxer in addition, it increases the risk for traction alopecia. But on top of that, we're wearing curlers, and now a lot of us wear our hair natural, but we'll still do the permanent rods, those kind of things. That actually can produce traction as well. And then the scarves that we wear at night. So we tie our hair up, we wrap our hair up in a scarf, but it shifts overnight, and it can rub the hairline off. So I usually recommend either using satin pillows or like bonnets that don't hug the forehead tight and it doesn't rub the hairline off. But again, that's the most common form of hair loss in our community. And unfortunately, like I mentioned, it's very disfiguring. sometimes people have not seen, someone's scalp forever, right? There's significant others, their children, family members have never seen their scalp because they're so embarrassed. And I feel like Black women go through enough without having to internalize shame that we can't even be seen in our natural state.
Seriously.
So I take it very seriously. And number one, it's very preventable, it's fixable. So as long as you're aware that it's occurring, if you see me as soon as it's occurring, I can reverse it. Otherwise, we have to do like a hair transplant, right? And so you don't want to have surgery to fix something that was preventable. So I always try to educate about traction alopecia in particular. There's another form of hair loss that is very cosmetically disfiguring, and unfortunately, we do have a genetic predisposition for this. It's a long term, but it's a scarring alopecia. It's called CCCA, central centrifugal cicatricial alopecia.
Okay.
The name does not matter. Okay. We call it CCCA.
CCCA, okay.
No one realizes how common it is. It's all I see all day, every day. So if it's not traction alopecia, it's the CCCA. It's rampant in our community. It's an epidemic. And every dermatologist that focuses on hair loss, or if you see Black women as your patient demographic, you're gonna see this all day, every day. That's how common it is. And I'm only one person
and I've never
in Kansas.
even heard of this before.
No, you wouldn't, because it's distributed in the middle. So it starts as an area of thinning or a widening of the part in the middle, and then it just gets wider and wider. And because we're fabulous and we have so many options with our hairstyles, like Black women are notorious for being versatile, right? Like, Cece, you have a different hairstyle every time I've seen you.
I mean, girl.
Right, so we're known for that, so we do an amazing job covering it up.
Right.
But unfortunately, some of the things that we use to cover it up further compounds the problem. But, we can wear a tight ponytail and cover it up. We can do wigs, we can do weaves, we can do extensions, anything, that we mentioned. And no one in the world would know that this woman had severe hair loss, and it's smooth, so the hair is all gone. And
wow.
And it's a genetic predisposition. We think it has to do with this mutation in a protein that forms the hair shaft. And for some reason, it leads to the body's immune system attacking the hair follicles. It can cause tenderness, burning, and itching. The hair falls out, and then it's surrounded by a scarring process, which can permanently prevent the hair from coming back. And I'm very passionate about this because I see a ton of it, and I try to educate hairstylists, barbers, cosmetologists, because they're the first people to see it.
Right.
And so they're kind of my primary care providers, because if they can recognize it, then they can send them to me so we can fix it. So it's very treatable, once again, but unless you have knowledge about it, then you're not gonna know what to do about it. So I'm very passionate about hair loss in our community, because it's actually one of the primary reasons that Black women in particular seek out dermatologic care. So if you're a dermatologist and you don't know how to correct hair loss, then you're doing a disservice to our community.
I think it's so important what you said, just as far as reaching out to barbers, reaching out to hairstylists and hairdressers, because it's like, you can't fix what you don't know.
Right.
And so if you're watching this, and you style hair, or you're a barber, and you see that, you really should be upfront with your client. Instead of trying to cover it up, send them to a dermatologist.
I really do try to work with stylists as much as possible, because their job is to make you look good, right?
Right.
Their job is to make your hair look as amazing as possible. My job is to keep the hair that you do have and try to get more. So I try to work with them as much as possible so that we have a good relationship, so we can provide the best work for them.
So one thing that we definitely see is that some doctors are not taking the complaints or the issues that Black and brown people bring to them seriously. So what advice would you give to patients who want their doctors to take them seriously?
That's a fabulous question. I'm so glad you asked that. And I feel that hopefully it's not most physicians that are doing this. I feel like there are some that just don't feel comfortable with certain communities maybe, or maybe they just don't. We know that many physicians, all of us, have internal biases that we don't know about, and unfortunately we treat people even in our exam rooms differently. And again, that's the reason why we need more Black and brown physicians.
Right.
There have been numerous studies that show that outcomes are actually different if you have a Black or brown physician treating a Black or brown patient, right? So first and foremost, try if you can to seek out a physician that looks like you, because your outcomes may actually be different. They may actually improve based on that. If you can't, of course, I feel the medical profession in general has a very high standard, and hopefully everyone has a good standard of care. Make sure that you advocate for yourself. Don't let a physician like myself just tell you something without asking questions. It's fine to question us. It's fine to say why. It's fine to say, okay, I understand that, but can you go into more detail, or you're talking too fast, or you're moving too fast, or wait, no, I don't want that, or, it's okay to do that. And I feel that, some people just don't know to advocate for themselves. So it's funny because I am a physician. Whenever I have a family member who's like in labor or something like that, I'm like, put me on the phone. Like my sister just had a surgery, and I had one of my friends actually go, like I called them. I know they work at that hospital. I was like, go into the OR, speak to the surgeon, put them on the phone with me, because I have questions that they wouldn't know to ask.
I just wanted you guys to know that's what Black Girl Magic is.
Well, right, I mean, you have to advocate for yourself. You have to advocate for others. I think the issue in the Black community is just that there's so much mistrust, and for good reason. Like, we need to acknowledge that there's a reason why we don't trust medical professions.
Say something.
The unfortunate thing is, like, now influencers, like on Instagram, YouTube, they are the ones giving the medical advice, and they're the ones who people believe. So people are not seeking out like cancer treatments or diabetes treatments or other things, and they think just, following a certain diet protocol will cure them. And people always wonder why, like, I just posted a psoriasis before and after. That was just a 3 months before and after. Someone with severe psoriasis, and then 3 months later they're completely clear. That's because of a medication. Now, you can do that with like natural ingredients, but you're not addressing the other issues, because something like psoriasis, you can have increased risk for coronary artery disease, you have chronic inflammation, all those, you can have arthritis, all those things need to be addressed. I'm honestly
learning so much from you right now.
Oh, well, thank you.
And it's wild because, I like to think of myself as in the know. I'm clearly not. I'm learning so much. So I can just imagine how much everyone else doesn't know around that.
It's hard because, even in medicine, like, I'm a specialist, right? So I do not feel comfortable speaking about certain subjects within medicine because that's not my expertise. Yeah. And so all of us can't know everything, right? So that's why it's important to seek out advice from experts who do this all day, every day, and have had years of training to do so, right? We're getting, as Black people, our Black community, we're getting our medical information from the internet, from people who really, like, they've read, but unless you've practiced medicine, unless you've practiced it and really done your research, it's hard to give responsible advice.
And I'm really happy you said that because, I obviously do a little bit of influencing here and there.
No, yeah, right.
I really try to use all natural products, vegan, all that stuff. But I know that there are some people out there pushing toxic products. Can you talk a little bit about that?
Yes. Unfortunately, there was a study that was done, and I'm so glad it was done. It was done by a group at Harvard. It was an environmental working group where they looked at products that were marketed towards Black women specifically, okay? And these are products that we all grew up with, okay? Everyone has used these products, okay? And they found that over 80% had toxic chemicals on there that were not listed on the back of the bottle.
Wow.
So they actually found that all the ones they tested had toxic chemicals. And these are chemicals that are hormone or endocrine disrupting. So they make us more likely to be premature puberty. It can be the reason that Black women in particular are more likely to have fibroids. Our genetics play a role, but that also was shown to be...
I literally don't know any Black women without fibroids.
Exactly. So there are some genetics that play the role, but these hormone disrupting chemicals have also been associated with that, and it's in our hair care products, and are some of our personal care products. But again, even if you had a degree in biochemistry and you knew how to read the back of the label, over 80% of those products did not actually have it on the labeling. And so these are things that really affect us, our well-being, our health. They're producing tumors, for example, and they may be associated with many things. And they've done studies that have shown that Black women in particular have higher concentrations of these chemicals in our bloodstream, in our urine, compared to every other demographic.
I'm baffled right now. I'm not surprised, because I think that Black and brown people have always been targets of big industry and really just hate and crime. But just to hear it and to know, like, this is me. Like, this I'm sure
it's
that's happening.
So we're like being harmed without knowing, right? Ooh. So again, it's being secreted into our bloodstream and into our urine. So it's in us systemically. And I think one of the things that plays a role, not just the fact that the chemicals are present, but it's the way we style our hair, right? So our hair is less easy to manage, which is why we do so many things to it, right?
That part.
If it was easy to manage, you cannot run a comb through anybody's hair, right? So we apply a lot of product to our hair, and then growing up, the pink moisturizing lotions, all those
blue
things.
grease, green grease.
And all those things have those chemicals in it.
Oh, Lord.
Yes. And so We apply a lot to it, and then we don't wash our hair for weeks at a time, right? And so we're applying more and more. It's getting absorbed into the scalp. And, we have to use a lot of product to even run a comb through our hair. So we're applying more product, we're keeping it on longer. So those are the things that kind of play a role as well.
I just absolutely have to say this. The magic of melanin, that we're still alive, period. Yeah. That we're still alive. Mm-hmm. Wild.
I always feel like we need to honor our ancestors as well because, we're very privileged, right? Mm-hmm. We're privileged to be like, I don't feel like having kids right now because this or, our ancestors had children in horrible states, right? But they survived, and then their children survived to have, for us just to be sitting here, right? So we have to honor that, and I think we have to move in a way that honors them as well.
Absolutely. Mm-hmm. And I think one thing that's really important for me is my diet. Yes. I know that, when I eat like crap, I feel like crap, and I look like crap.
That's not possible.
Girl, she's right. No. So how important is diet when you're talking about your skin and your hair?
Okay, so with any medical condition, there are three things that play a role: genetics, environmental factors, and systemic factors. So systemic factors would be like your diet, for example. So what's going on the inside. So diet does play a role with a number of entities. For acne, for example, we know that diets heavy in dairy and sugar are more likely to have problems with acne.
My favorite things.
No, of course. But, genetics play a role. So if you're someone who has nobody in the family with acne, that probably plays a heavier role than what you're eating. But it always plays a role. I always advocate for anti-inflammatory protocols, anti-inflammatory diets, which would mean that you would have less meat, dairy, grains, sugars, and more plant-based. It includes certain products like turmeric and ginger and ashwagandha and things like that are anti-inflammatory, good antioxidant. And ashwagandha, for example, is considered to be an adaptogen, which means it helps your body respond to cortisol better. So those are good things to make sure that we have in our diets.
Awesome. Mm-hmm. And then one thing that I think is really important to talk about, I know I went natural in law school.
Yes.
And I was among all white people. And so on one end, I was like, this feels really weird. On the other end, I was like, they don't know what's going on with my hair, whatever. It's so important that young Black and brown ladies and women and girls really embrace their natural hair. You have beautiful natural hair.
Thank you.
And for you, I know that you had a perm at one time, but
yes.
What was the move? What was the change for you?
Yes, and so I want to make sure, like, as naturals, I feel like there's a lot of shaming for people who use relaxers. We've all done it. It's okay.
Yes.
Especially the Midwest.
We're not shaming you.
No, there's no relaxer
shaming. We're just
shaming.
calling you home.
Right. No, exactly. But again, we know that products such as relaxers can actually harm us internally, which was what I mentioned. It has toxic chemicals in them that can be absorbed into our bloodstream and may be related to our formation of fibroids. So it's not just something that, it's a hairstyle. It actually affects our health. Mm-hmm. So I actually went natural also in medical school, and I looked crazy because this is back when there was not a movement, and so there was like one product you could use, and it looked like I had a jerry curl all the time. But I will say, natural is just so different, right? Like if we straighten our hair, which all of us can straighten our hair even when it's natural, we look the same. We all will look the same. But our curl pattern is like our fingerprint, right? Like
beautiful.
No one has the same curl pattern. It makes you so much different than everyone else. It makes you actually special. And you are wearing your hair with the way that everyone intended, right? Yeah. Like you were born into it, right? And so I think if more of us wear our hair natural, then it just, again, representation matters. Then it won't be something where it's considered unprofessional or unkempt or something where we don't belong because of the way our hair looks. And I definitely, when I was in residency, I had someone put on one of my evaluations that my hair looked unkempt, which was crazy to me because I would wear my hair in a messy bun all the time, right? So like if you have long straight hair and you wear a messy bun, that's a style. For me, It was a whole like unkempt look apparently, but I felt that it was incredibly insensitive. And if they wanted to volunteer to do my hair that day, then
Period.
Like, unless you're trying to help me with my hair, then I don't care for those statements. But I do think with the Crown Act in particular, that makes it illegal to discriminate against someone for their hair. That is helpful. Mm-hmm. But again, we need to help people like normalize us, right?
Absolutely.
I don't feel that we need to continue to assimilate to what the current cultural norms are, which is, you know, having hair that doesn't make anyone feel uncomfortable, right? They need to become comfortable with us. Everyone needs to be comfortable with
damaging our hair to look like a standard that was never meant for us.
Right.
One of my favorite things is walking into court with a huge afro and be like, I'm the lawyer.
Absolutely.
Period.
Absolutely. And actually, my hair was straightened. It was natural, but it was flat ironed in most of my profile pictures. And all of our marketing was from that time when I had flat ironed my hair. And we actually just did new headshots because I said, this doesn't look like me.
Yeah.
You know, these are beautiful pictures, but it doesn't look like me. When a patient walks into the room, I want them to expect this. And I need them to know what I look like because I want them to feel comfortable with me before they walk into the room. And if they are not, then they have plenty of other people they can see. So.
And that's what I love about you, is that you're honestly putting the image of who you are, but also what a successful Black woman looks like.
Thank you.
It just is what it is.
Thank you.
Thank you for tuning in to Up Close and Cultural today. If you learned anything, tell a friend to tell a friend, and check us out on our social media platforms, and definitely follow Dr. Meena Singh. If knowledge is power,
then power to the people.